Hello there. Welcome to my car. I am hanging out at my daughter's volleyball practice and going live with you all. If we have not met, my name is Julie Hirschberg. I'm a neurologic physical therapist, and I join this community online every week to share what we're learning and doing here at re+active. And this tonight, particularly, why I really wanted to join you, even though I was going to be here in my car, is I wanted to talk about this important topic of differential diagnosis. And I shared a little bit about it earlier this week when we talked about functional cognitive disorders. And today I wanted to talk about when disorders are not an either or, but an and. And a lot of things sparked this particular question or topic in my mind, and a lot of it was coming from other healthcare providers that asked, well, what if I'm seeing this and this, or I'm not sure, and maybe it's actually both. And I got another great comment actually on another post that said, well, haven't you seen people that were misdiagnosed? And yes, we see people misdiagnosed. And oftentimes it's with an and. It's like they have something and something else. So I want to share what I shared earlier and talk about this. So this is the post from today, Differential Diagnosis in Therapy. By the way, I'm not a neurologist, so I'm not actually making a diagnosis. As a therapist, though, I'm screening to ensure that the diagnosis matches. And so oftentimes when we're screening, we're going, well, is this Parkinson's or is it not? But sometimes it's actually both. So this happens a lot in neurology, happens a lot for physical therapists, and I think particularly in movement disorders. So, for example, we might actually ask in dystonia, is it idiopathic dystonia or is it functional dystonia? And I shared one of the posts that I've shared before, where there's some great literature to help us distinguish between idiopathic dystonia and functional dystonia. They can tend to have a different onset, maybe different precipitating events, a different course, as well as some differences in our clinical exam. There's some great literature to distinguish these types of dystonia. Now, what happens more, though, I would say, so it's great that we can distinguish different types of dystonia. What happens, I think, clinically more often is that we see both. So it's not just an either or, is it idiopathic, is it functional dystonia, but we see that the person has dystonia and functional dystonia. And the literature supports this. So I've been pouring through the literature as I'm prepping for the mini course that we're doing in our Bytes group. And oh my, I lost my light here. Hold on a second. Let's see. I am sitting in a dark car, and I'm sorry that I lost my light for you here. Let's see. I'm going to actually turn on the light here. I didn't even think about this. Here I am sitting in the car, losing my light for you. So the literature supports, and there's lots of interesting literature in this realm. And in Parkinson's, for example, there's quite a range, but up to 20% of people with Parkinson's also have a functional neurologic disorder or functional symptoms. Same in MS. Up to 13% of people with MS may also have functional symptoms. So interesting. So this literature in because it's really showing us that indeed we need to really attend to the overlap of these things. And as a therapist, we do this when we're screening, but then we also need to make a formulation to really understand the person in front of us. And so that's where I want to share yet one more pie chart with you all. So this is the diagnosis pie chart. So this is really, what do we do with these overlapping syndromes? And I got to tell you, it was Dr. Alan Wu, who's now at Northwestern, great movement disorder neurologist, that he really brought the diagnosis pie chart to us at re+active. And he kind of said that this is what I have to formulate and discuss with the person in front of me, that they may have more of an overall syndrome versus just one symptom or diagnosis. So we're going to talk about this in our Brain Bytes course tomorrow night, Thursday night. But I wanted to bring you a little peek of this, because when that person presents with cervical dystonia, we're going to actually talk about a really great case. I cannot wait to share this case, because also this person with cervical dystonia has had full resolution of her symptoms. But when that person with cervical dystonia comes and we meet them, we are looking at both the cervical dystonia and maybe other things, and we kind of have to formulate that from a diagnostic standpoint. So particularly, we might take those things that fit idiopathic cervical dystonia, this slow, gradual onset, repeatable and consistent torsional muscle contractions, in this case with sternocleidomastoid, consistent relief with a sensory trick, and a very great response to Botox. So that's very common what we see in cervical dystonia. Now, this person, not everybody, but this person also had components that seemed like a functional dystonia. So they reported there were a couple of instances where symptoms were completely gone for a few minutes. They woke up one day, they were gone, then they came back. And then occasionally this person also had large improvements, like major improvements when we did a very high load cognitive dual task. Not enough for me to say, well, this is all a functional dystonia, because that was very hard to repeat, but definitely components of functional dystonia. And then finally, and we see this a lot in our patients, is there might be other issues. So particularly this person had a shoulder injury and some shoulder pain that I actually preceded the cervical dystonia diagnosis, and there was some swelling, there was some limited range of motion, there was some pain, even some muscle guarding. Some of that might have been even a predisposing factor for the cervical dystonia developing, but we have to consider that as part of the diagnostic picture too. How might this orthopedic injury be contributing to the movement problems that this person is having? So this is our diagnostic pie chart. We take those pieces that we've screened through a neurologic exam, and oftentimes what we're seeing is an overlap, not an either or. Like, this is not just cervical dystonia, it's not just functional dystonia, and it's not just a shoulder injury, it's actually all of those. And what you can see here is, in my formulation, I think the main component in this particular case is cervical dystonia. There's a functional component and the shoulder injury is a component. But this diagnostic piece helps me move forward, helps me make a plan, helps me know where to go into treatment. Now, I will also, as you know, we have lots of pie charts. I will also conceptualize what are the underlying issues here: motor control, sensory, autonomic, lifestyle, psychosocial, physical impairments. That's very different than this diagnostic pie chart. The diagnostic pie chart helps me conceptualize the underlying diagnoses contributing to those impairments. And also, do I need to refer this person out? Do I need further workup here because they haven't, maybe been diagnosed with these other things before? So that's the diagnosis pie chart. And this is a big component, by the way. If you are a Brain Bytes member, we are talking about this tomorrow. So We have a mini course in our Brain Bytes group. We kick off the new year with advanced differential diagnosis in neurology. And this is all new. This year is really this focus on overlapping syndromes. So if you're in Brain Bytes, we got this going live tomorrow, Thursday, 5 o'clock Pacific time. If you're not in Brain Bytes and you're a healthcare provider wanting to do this deep dive with us, join the wait list. You'll be the first to hear about when we open up our doors. We do it twice a year, so we'll do it in the coming months. And also, I'm sending a special newsletter to the folks that have signed up for the wait list. So you'll get some extra little neuro nuggets from me, because I know that you're interested in some of these key topics as a healthcare provider. So thanks for joining me for this extra live session in my dark car here in the volleyball parking lot as I wait for my daughter. And thanks for your interest in these topics too. I so appreciate you. And if you're on our newsletter, by the way, already, I will be sending out the articles associated with this post, the videos, and all of the resources. So if you are a healthcare provider, join at reactiveeducation.com. If you're a person with a neurologic disorder, join at reactivept.com. And I'll send out my newsletter this week with all these great resources. So thanks so much for joining me today. I hope you have a great evening, and I will see you soon.